This conference will now be recorded. This conference will now be recorded.
Let's record and we are starting your station. This is your station. Take your 2 minutes. Okay, your 2 minutes are over. So I'm going to start with the station. I hope you can see me now. And let us start.
Not able to see the.
The station?
Yes, ma'am. I started
You
seeing
have.
it disappeared. Just disappeared, ma'am.
Yeah, because your 2 minutes are over, no? So you have to be inside the cubicle now.
Oh, sorry, ma'am. I have written as Mary Smith, 36 years, para 1, antenatal,
Right.
abdominal discomfort at 32 weeks. Only this much I have noticed, ma'am.
Yes. So you
Anything
can
else is
start.
there, ma'am? Oh, okay.
I have mentioned urine diagnostic is normal.
Yeah.
All the other observations normal by the
Oh,
midwife.
yes, ma'am.
This is the third time has come to the OPD.
Okay. Shall I start, ma'am? Hello. I am
Hello.
Dr. Monicam. Dr. Monicam, doctor in clinic today. May I check your name and age, please?
Doctor, I'm Mary Smith. I'm 36 years old.
How you want to be addressed?
You can call me Mary, doctor, not a problem.
Mary, I came to know that you got pain, abdominal discomfort in your tummy, and you are in 32 weeks in your second pregnancy. Am I right?
Yes, doctor. I'm having this discomfort on and off, and it is always
Mm.
pain in my tummy, and I feel that it is affecting my child, and I don't know whether everything is going okay or not.
I'm sorry to hear. Do you have any other concern to discuss today?
No, doctor, this keeps on happening every now and then, and this is the third time I have come here.
Mhm.
Every time the midwife tells me that everything is okay, but I just feel that something is happening. I just feel that my baby is not
Mm.
okay.
Okay. Do you have what is the expectation? out of this consultation today, want to know about the baby.
Yes, doctor. The midwife has
Mm,
told me that the baby is okay, and she also
mm,
heard the baby's
mm.
heartbeat, and she was saying that everything is fine. And
Okay.
still having this discomfort, I just feel that something is not right with the
Mm,
baby, and
okay. Mary, so far, how was your pregnancy?
this is the first time I'm pregnant, and I'm about 32 weeks now,
Mm.
and yeah, I'm
Is
having
this
this
your first
kind of.
pregnancy?
Yes, yes, doctor.
Okay. This is a planned pregnancy?
Yes, doctor. We kind of planned it before
Mm.
going for that.
Do you have any complications so far? Have you undergone the blood tests, the scans, everything?
Yeah, yeah, doctor. Every time I come, they say everything is normal.
Mm. I want to go through your reports also. Uh,
Hmm.
have you named your baby?
Actually, my husband, he doesn't have much time, so we kind of don't talk about it. But we are going to name the baby soon. Yes,
Okay.
that's the
How the baby is doing? Is the baby happy inside?
yeah. The midwife says that everything is good with the baby.
Okay. You're having some discomfort only. Do you have any
Yes.
discharge down below?
No, doctor.
Any leak of fluid?
No, no, doctor.
Any urine symptoms? Any problem with
Oh,
waterworks?
yeah, that I think I go to pee frequently, but then they say that that is normal in pregnancy. So,
Mm.
but yes, a
Uh,
little bit of increase in the frequency.
any burning? Burning while peeing?
No, doctor.
Mm. Any down discharge down below?
No, doctor.
Mm. Shall I ask you some personal questions?
Yeah, yeah, doctor.
Any history of treatment for sexually shared infection?
No, no, doctor. I don't think so.
Okay. Mm. One more thing, it will be confidential. This will not be shared with anybody else. Um, have you ever been sexually approached by anybody in your childhood?
No, doctor. I mean,
Hmm. One more thing I want to assure you, whatever we talk, it will be confidential. It will not be led to anybody outside. Are you happy at home? How is the support in family?
um, yeah. I mean, yes. I have a husband. He goes to the job.
Hmm.
He makes money. I think everything is good.
Is your husband happy with you, or he is rude towards you, or he is any sort of threatening, emotional threatening, or hurting you, or is he hitting you? You can be free with us. We doctors, we do not say anything outside. This is a common thing occurring in women who are pregnant, especially. It happens in one in five women. The help is available. You can come out, Mary. We are here to help you. There's so many support groups are also available. This women should not be treated like this, Mary. You please come forward. This will be kept in confidential. Hmm.
I just don't want to say all this, doctor.
Sorry to hear.
I
Uh,
did. I so much work.
do you um, how do you can you go home safe? Is it safe to you to go home after my examination, the going through the scan, everything? Is it safe for you to go home?
Ah, I,
If
yes,
if it
doctor.
is, mm,
Yes, in fact, we kind of planned this baby and everything, but
mm,
sometimes he's very violent, and I'm
mm,
very much afraid of him sometimes.
yeah,
He's good in fact. Otherwise, he's good. He's a good
mm,
daddy.
mm,
But sometimes he hurts me, and that's why
mm.
I feel that there shouldn't be any problem to the baby in my tummy. So I'm worried.
I- If such things happen continuously, this can affect your baby's growth, and you can have a early labor, and there is a chance of the baby heartbeat is stopping in the womb itself. So if you feel if it is not safe to go home, you'll be offered admission in the hospital itself, and the support groups are there to help you so that you'll be provided safe environment. Uh, I mean, the residing place, residence, and the working options also available. And you'll be offered money, everything they'll be providing you. And this need not be, you need not suffer with this condition with so much of patience. It's really, I'm really sorry to hear this. Mm,
Yeah, thank you so much, doctor, for that support because for now I
mm,
think I'm go home and I just take care of him most of the times, but he's
mm,
in the bad mood sometimes. Uh, but yes, I can always take help of the things
mm,
that you have.
mm,
But they
mm.
should not be telling my husband. My husband shouldn't know that I have told my
He will
baby.
never come to know this. Is there any children in home at risk? Is there anybody
No,
else at risk? No. And one more thing, I'll go through your case notes on, and I want to examine impression of apron with your consent, and you will be offered the examination of the scan also for the baby's heartbeat and the growth and the fluid around everything will be done. Your care will be under the consultant led unit in the by group of specialists, including my consultant, specialist midwife, and supporting team, and the psychological counselors are also available. You need not worry about this. An imaging doctor is there, so you'll have frequent scans. And one more thing I want to advise you: if you can have a safety plan also, you can have a bag with some amount of money and your passport and your personal belongings and bank lockers and key like that. Important things you can keep in a bag and keep it in a safe place, and you'll be offered the safety emergency numbers. You can have it written in that small book, and you can have it, and you can use, and if you find it, if it is not safe, you can have this escape plan, and you can go out of your home. There's so many possibilities are there. So, do you have any other problem of having any smoking or alcohol? No, nothing. Any other medical conditions? No. Any allergies? Nothing. Any surgery before? No. Any family members are there for you to help? Your brother or sister? Nobody is there.
no, no, doctor.
Okay. Um.
Actually, the only thing I just want to know, like you have told me about everybody who can come to help me.
Yeah.
What if I have them or if they have to contact me? How to do that and without letting my husband know?
Uh, this is supporting the safeguarding midwife is there. She'll offer you all the numbers so that you can contact them, and your husband will never come to know. And if you have any, uh, even if you come with your husband, if you have any feeling of fear, you can keep a red dot over that urine bottle so that we'll come to know that you are in stress, and help will be made available to you. And the safeguarding team staff she'll be following you, and she'll be providing all the support, and this will never will be known to your partner. And if you do not have any faith in him, you can come out of his uh, hands at any time. You have the freedom to come, and your child baby will also be cared by the supporting group. Do not worry. I'll give you the
Yes.
patient information leaflet and everything. I'll give you. and I'll inform my consultant also, and I'll arrange an appointment with my consultant so that he can come and have a discussion. Now, if you don't feel like safe, like to go home, you can please inform me. I can make arrangement for the admission. Whatever you feel, it is up to you to decide.
Thank you,
There is
doctor. And
some
your time
problem
is
with.
all.
Yes, ma'am. There is some disturbance also, ma'am. Sorry, ma'am. I'm not able to express fully.
No, no,
There is
I
somebody
can hear
talking, ma'am.
every. No,
There is, there is some disturbance, ma'am, going on.
is it? Because
Yes,
I
ma'am. There
cannot
is some.
feel anything.
I
Let
am
me see
hearing,
if it
ma'am,
is.
something. You are able to hear, ma'am,
Okay.
some sounds. Thank you, ma'am.
No, no, but I feel that you did it very well in spite of
Thank you,
everything.
ma'am. Mhm. But
I hear anything.
but I was not able to complete the history, ma'am, and that's
Yeah,
why I felt.
yeah, but then it was very, very, very good.
Your
I
facial
think you
expression
covered.
was very excellent, ma'am.
Oh my
you
God.
are you are bending forwards. You are looking down. Just because you opened the camera, I was able to find out, ma'am. Very nice
Yeah.
expression, ma'am.
So that is how the role players are going to be, and you have to be very prompt and you have to find out. So actually, I think you did a very, very good job. And finding out which patient is having a hidden agenda itself is a
Mm.
task. So once
Yes,
you've done that, you covered half of the station. And the later half is about your communication and how you deal with the patient.
ma'am.
Now, as far as the feedback goes to you, I think you are doing a lot. I mean, I feel that you have tremendous energy, and I'm not someone who have to give you feedback. But if there are few things I think which could have been better, one thing that you already told is information gathering. Like first finish off everything, and then
Uh,
start with the agenda, right?
yes, ma'am.
Even that the patient is now is looking disturbed, you just have to finish it so that you once you go into that you cannot come back to something because
I
it.
can. I was not able to. Yes, ma'am. Well said.
And the other thing I think is when someone is crying, I think one thing is you can just offer tissues and you
Uh,
may just say that do you want to continue. You
mm.
have to ask the person
Oh.
to continue, or you can take your time. It doesn't matter. So
Mm.
then you say, no, no, you please continue. Because
Mm.
if you keep talking when I'm crying, like you gave me a pause, but then you suddenly asked about whether it is safe for me to go home, because it may just push the patient into more of crying thing,
Deep,
and
deep.
somehow
Mm.
like you're not very sensitive to the crying. You're more
Mm.
concerned about whether the person is harmful, because the person may not be that harmful, may not be,
Mm.
there must be just domestic violence that is going on, which
Mm.
might not be of that level. Or
Mm.
even when most of the patients, they may just say that my husband is good, my husband, they have this guilt, no, so they keep
Mm.
on saying, most of the role players, they have this habit of saying that my husband is actually good, don't say all this, but he beats me sometimes. So of course you have
Mm.
to say that this is not the way, because this is going to affect you, your mental health and your child, which you covered very, very nicely. I think you covered the whole of the station very nicely. These are only two things I think
Mm.
which need to be covered. And when I asked you that my husband shouldn't know, you have to tell this beforehand only when you have information, no?
Mm.
First thing is, you started giving information, you did not ask whether I am with you. You started
Mm.
giving information for 2-3 minutes continuously, and because you could see me, I was nodding my head, you understood that yes, I am listening to you. But in
Yes, ma'am.
between, try and ask, uh, are you getting me? Or
I will ask. Yes,
yes.
ma'am.
And one more thing is that when I asked that my husband shouldn't know, you should yourself tell, in fact, that don't
Mm.
worry, these support
Mm.
groups, they'll be there, they'll be taking care of you, they'll be checking on you once in a while, and they'll come in a casual
Mm.
uniform. They'll not be dressed like a doctor or like a
Mm.
men- mental
Oh.
health people. They will be dressed regularly and they'll come to see you as a regular public, maybe someone like a plumber or something like that, and they'll check on you. They are expert in it. You need not
Oh.
say everything, just say that they'll come in a regular uniform and they are expert in it. They know, they have handled the situation, so they know. and your
mm,
husband will never. I think that much is enough. And of
mm,
course, you covered that urine dot thing. Of course, when the patient asks you specifically that next time my husband wants to come with me, and how do I, if I have to tell you something, how do I tell you? Of course, you have to tell that there's something called as there are many schemes, actually many things that are going on against the domestic violence. So you may just say that, even if you don't know, you may just say that I'll hand over this thing to you. You may just read it after the consultation and put the thing here only, keep the information leaflet here only, so that you will come to know about all the strategies that we have to
mm.
help women who are going through domestic violence. There are
Okay,
many
ma'am.
things
Mm.
taught on the this thing.
Ma'am,
So
then I
that.
should say that, ma'am, this will be only written in the hospital records. It will not be held, recorded in your
I'll
handheld notes. That also I should
Yes, I'll do
say. Mm,
that also. You
okay.
right.
I have missed it.
I think these are only few things that you missed. So just to finish, the rituals of going through the model answer. I think you and me now, we both know what is the model answer, but we'll just finish that thing. Uh, I'll stop sharing the camera.
Mm,
Just a minute. So, of course, domestic violence, usually comes as an antenatal case or even as a chronic pelvic pain patient also, no? Sometimes
mm,
there's vague symptoms. So, of
mm,
course, first thing is introduction agenda and signpost the consultation that you already did. Whatever you are going to discuss will be confidential, which you already said. And of course, only then the patient is going to disclose things. So, first,
mm.
finish off the
History.
everything
Mm,
about the booking bloods, the ultrasounds, everything.
mm,
Then past obstetric history, which you asked. You also asked about the children. I think you're doing very good.
mm,
Uh, then going to asking about how are things at home, the partner, occupation, who supports you. Her
mm,
occupation again is was important. I think that was missed because
mm,
the history was missed. So what you do
mm,
for your living, so that she can
mm,
support herself. That is a very important thing.
mm,
And by
mm,
now you would be sure that there is something wrong because of the
mm,
living. So go into saying her that a lot of women are abused. Even if the figure is wrong, it is okay, 1 in 5, 1 in 4, but you may
mm,
say many women are going through this. And
mm,
so do not be scared,
mm,
and don't worry, it's very confidential. So the next step is,
mm,
yes, again, this is also very important. When the patient is not telling things by herself, you have to ask, have you feel threatened, or do you feel low? Sometimes it is domestic violence with the mental health problems like
mm,
depression and everything.
mm,
So again,
mm,
you correctly said you'll have to send her to the counselor because she must
mm,
not be in a very good mental health.
mm.
Okay, so are you physically hurt? Have you had
Yes.
any episode of violence in the recent past?
Mm,
Were there any weapons used? Of course, this should be asked very gently because
mm,
sometimes people get offended by asking this.
mm,
Uh,
mm,
there are in fact many things when it comes to asking the sexual partners, whether it is
mm,
husband or boyfriend. You have to be very gentle when you ask. You have to
mm,
always signpost, give
mm,
a warning shot before you're asking this
mm.
thing. So
Okay.
I know this might hurt you, but let me ask you whether he uses
Mm,
any weapons
mm,
or hurt to at a very severely. Are you hurt? So she may then tell that yes, he sometimes is very. He sometimes uses a gun to threaten me or something like that. So if that
mm,
it is that, of course, the station goes in a very different way. Then are there kids at home which you covered? Have you discussed this with your relatives or friends, which again you covered? And do you feel safe to go? So I think
mm.
this question should come at the end when she has
Okay,
disclosed
ma'am.
everything.
Mm,
Then you ask, now after you have told me, do you feel that it is safe for you to go home? Because now is the time for you to finish the consultation and now she has to
mm,
go home. So then
mm,
you start telling that even if it is whether it is safe or not,
mm,
you have all these facilities. And then you
mm,
start saying
mm,
we have this support
mm,
groups, we have this safeguarding midwife, we have this
mm,
uh, people who act against domestic violence. You can also have an escape plan if you want. So all these things now they keep on coming hereafter. Of course, if there is an examination part which is left, in this station, the examination was already done and everything was normal. Okay, so I'm not expecting this in at this part, but sometimes it is possible that there is a patient who has directly come to you, and you have to examine her. Then you may just say that let me examine you in the presence of chaperone.
The chaperone with your consent.
Yes, you told about all the complications that can happen out of domestic
Mm.
violence, that is low weight, early
Mm.
labor, unexplained stillbirths, affecting
Mm.
the other mental health of the other children. So everything.
Mm.
Uh, so again, you have to tell about provide information about the shelters, the local support groups, and also the legal aids like Women Aid, Domestic
Mm.
Abuse, 24-hour helpline, all the helplines.
Mm.
You just say
Mm.
one of them. Women Aid, I think, is very
Mm.
common and easy to say.
Mm.
Again, you actually spoke about everything. You also spoke about consultant care, right? So
Yes, ma'am.
that's a very good thing. So again, domestic violence advisor and a domestic
Mm.
violence or a specialist midwife in
Midwife.
this, right? So
Yes, ma'am.
if you go home, you have to offer admission, which you already said. But I think do not say it like you have learned it, you know. So if you don't
Mm.
want to go home, you can stay here. You may just ask, do you feel
Mm.
like going home? She says, yes, I
Mm.
can go home. Then you may
Mm.
say, okay, that is okay
Mm.
for now. But if at any
Mm.
point of time something arises that you cannot go home, you may remain
Mm.
admitted here. I can put
Mm.
you here.
Mm.
So it
Okay.
should come naturally. It shouldn't be
Mm.
something that you have
Mm.
ratified something or you have gone through the station and now you remember everything and you're saying it out. So it should
Mm.
actually be according to the patient.
Mm.
So and that this can be made out, when
Mm.
we sit as examiner, I think we can make out who has
You'll be fine. Yes, sir. Yes, ma'am.
so I think it should be very natural, okay, and
Mm.
that feedback. I like you have completely
Mm.
passed the stage. A few things.
Mm. You should add.
Everyone,
Yes, ma'am. Mm.
will be listening also because
Mm.
I'll be putting this up for everyone too because it's a very very good station
Mm.
for everyone to listen to how to go about this domestic violence.
Excellent discussion, ma'am. I feel you have revised. You have conducted a session for me specially. Thank you so much, ma'am.
Oh, you
Mhm.
need that. Yeah, I mean, I think hats off to you. I mean, you are an inspiration always. I always feel
Thank you,
how
ma'am.
you are so.
Thank you so much.
So let us finish this. Escape plan is again, as
Uh,
you correctly said, then making copies of all the important personal and family documents.
mm.
And again, her driving license and keeping it at one place, all the important documents, so that she has the escape plan. She can use take it from somewhere. Again,
Mm.
you already said about that, how to go about the escape plan. So extra set of
Mm.
car keys and everything. That is
Mm.
all optional. If you have
Mm.
time, say it. Otherwise, escape planning says everything, right?
Mm.
It means everything.
Mm.
Because see, at the end, then you don't have time to give her information leaflet. Then you don't have time to tell her about the social child safeguarding services. At the
Mm.
end, the last one, the reassurance that you
Yes,
have
ma'am.
to give, that you missed the time there. That
Mm.
last 1 minute you extended
Yes, ma'am.
because you were telling her about the escape plan, about how to
Mm.
go, because everybody knows what the escape plan is.
Mm.
So you may
Mm.
put your time on saying that these people will tell you about the escape plan. You may just keep your things outside at a
Oh.
safe place so that it will be easy for you to collect if you have to
Mm.
go. And these people will be helping you. So they will be
Mm.
coming in a regular attire. And
Mm.
don't worry, your husband will never know. They'll keep a watch on you and keep on
Mm.
asking you if you're okay.
Mm.
And later on, you may just say that if you have to come with your partner sometime, then of
Mm.
course we have these different strategies on how you can tell us about what is going on.
Mm. Mm.
I think most of the things will be covered. If you even say these lines, I mean, even if
Mm.
you quote these lines as it is, the
Mm.
examiner will know exactly what you're going to say, and even the candidate is going to, the role
Yes,
player
ma'am.
is going to
Mm.
understand telling about these things. So that is how you can finish your station in time and also gain, like, cover up everything.
Mm.
Uh,
Okay, ma'am. Thank you.
So that is it. And I think like for now, one station for one day. Uh, Let me